What we're going to do is a simple 3-minute or less routine that you can do right before you get out of bed in the morning to eliminate or at least significantly reduce your back pain when you get out of bed first thing in the morning. This is most applicable to people who are big time side sleepers. All right, so you either kind of sleep on your side, kind of curled up like so, or if you're a stomach sleeper, you kind of end up laying in bed like this, one leg up, sort of turned to one direction. Or you're a back sleeper, but you have some sort of a pillow or something underneath your knees. So what we're going to do first off is get the pillow out from underneath your knees if you're like that. If you're on your side, you're going to turn over on your back. If you have back stiffness that goes on both sides of your back, you're going to do this on both sides. Not at the same time, but in a row here. If it's only on one side of your back, so say for this example, it's on the right side of my back, what I'm going to do is I'm going to straighten out my right leg and I'm going to grab my left leg and very gently pull it to my chest. Now the goal here is not to have any discomfort at all. You don't want to stretch. You basically want to feel like you're doing a whole lot of nothing, okay? Essentially what I'm doing is I'm stretching out the muscles on this side, which are what are causing your back pain. So we're going to kind of hang out here for about a minute, which is a pretty boring period of time, but again, you just woke up in the morning, so don't really work really hard to do this, just kind of do it a little bit. After about a minute, all right, if I happen to have back pain that's on both sides of my back, I would switch legs and I would pull on this guy. Exact same thing, very low key, again, spend about a minute. If it's only on one side, the side that you're working on is the side that's straight. So if my right side's uncomfortable, my right leg's going to be straight. I'm going to pull my left leg to my chest and vice versa. If it's the left side of my back, my left leg is straight. I'm going to pull my right leg to my chest. Okay, remember, no discomfort, no stretch, no nothing. Basically just holding your leg. If this is uncomfortable, you let it go a little bit more. If that's still uncomfortable, you can just kind of grab back here behind your knee. All right, nice and easy. After that minute or minute per leg, depending on where your pain is, you'll relax both legs out, let both legs flop on out sideways, and then the idea here is that you're trying to squeeze your butt cheeks together. Okay, you're going to hold about 3 seconds and then relax. Now the goal of this is only to squeeze your butt cheeks, not to hold, flex your tummy, not to hold your breath, not to flex your thighs. So one thing that can help is as your legs are relaxed out sideways, rotate them out just a tiny bit more before you squeeze. That should allow you to feel just like these are squeezing without feeling like you're squeezing everything else. You can do 10 repetitions, 3-second hold per butt squeeze. All right, then when you're done, you're going to turn all the way over to the side that you're going to get out of bed on. And then to sit up, you're going to drop your legs off the side of the bed and use your hands to push up. So either I can push like this to push up, okay, or sometimes I can even kind of go like so and push with this arm into a sitting position. Okay, from this position you may need to sit there for a minute or so just to make sure the room's not going to spin when you get up. And then once you stand, the goal here is to feel like your back pain is minimum 50% better than it typically would be on any given day getting out of bed. There are some times where you're looking to feel like that actually feels great. All right. Normally, if you get out of bed and it takes you 30 or 40 steps to kind of feel like you work the kinks out back here and finally start to feel like your back pain went away, this is to hopefully jumpstart that so you feel like I've at least been up for a little while and I've kind of worked the kinks out. So it's to get you there a little bit faster. Try this. Super simple. Hardest part about this, honestly, is remembering to do it before you get out of bed. So if you do hop up and kind of go to the bathroom or something to start your day, you can always come right back to bed and just go ahead and do this. And that should, again, once you get back up, make you feel a whole lot better.